Good morning. My name's Chuck O'Neill. I'm Deputy Executive Director of Administration with the Kentucky Board of Emergency Medical Services. Today is May 19th, 2021, and 10:30 a.m. Eastern Standard Time. And we appreciate all the EMS administrators from Kentucky joining us on this call for EMS Week 2021. We're going to attempt to provide you with some updates on K-Beam's operations and answer any questions that you may have. We do appreciate everything that you do, and we appreciate all the work and sacrifices that your staff and yourselves provide for the citizens each day as you come into work. Happy EMS Week 2021. And I'm going to turn over the microphone to Executive Director for K-Beam's Michael Poynter. Mr. Poynter.
Thanks, Chuck. I've got just a few things I'd like to update and brief the group on this month. First of all, you should be aware that we have relocated. I think I've mentioned that in the last few meetings, but our new address is 2464 Fortune Drive, Suite 195 here in Lexington. It's only about a mile from the previous office. It's much, I think it's more modern. It's a good layout. We've got it structured up where we have good telecommunications equipment. That we just had new teleconference equipment installed. And as we move forward, I see a little different in our operations. I think we'll have in-person meetings, but it'll be a hybrid where we'll have an option of in-person meetings and committees and/or teleconference. So we have modern equipment. I think we'll be able to grow into that and move forward at a good pace. Next item is if you've been monitoring our social media, Greg, and he'll talk about this later, we've been very active in putting new information on there. Yesterday, our staff met with an organization called Camp Hero. This is a not-for-profit organization in Eastern Kentucky that basically offers outdoor excursions and events for first responders, military, EMS, fire police at no charge. We're working on some projects for EMS that have been in the works. We've had a tough year last year. I know a lot of folks were mentally drained, let's just be honest. And it's been proven that outdoor activities really helps the mental status. And that's something we're finally in a position where we can be more proactive than reactive on this pandemic. So this is down in Eastern Kentucky, like I said. This organization has right at 2,000 acres of wilderness, and they have, camping facilities, a cabin on site. It's really a nice place. I'm going to do a site visit here in the coming week, I hope. So I'll keep everybody informed on that, but please visit our social media and you'll have up-to-date information with that. Last item for me is we've been heavily involved in the mass vaccination sites across the state over the last year. And I just got off a call with state leaders, and we have basically shut those down or in the process of shutting those down this week across the state. And that's been shifted to all the Krogers across the state, CVS pharmacies, Walgreens pharmacies. So we got to the point where the appointments were not getting filled. So basically now you can go to your local Kroger or Walgreens or CVS and get that taken care of. So that's it pretty much from me. With that, I'll turn it over to Paul Phillips, our Deputy Executive Director over Operations. Paul.
Good morning, everyone. I'll reiterate, Chuck and Mike, happy EMS Week. I just want to thank each of you on behalf of myself and my family for the, just comfort and protection you provide all of us. You're appreciated. We are grateful, and we're really excited to celebrate all of you. So thank you again. Again, just like the others, I'll have a few updates here. So first thing I want to address, I sent out some communication to all the directors last week about the blind insertion airway devices, and I wanted to reiterate that and kind of explain it So we've had some issues lately of an interpretation of the regulation being what constitutes pediatric and adult sizes in the blind insertion airway devices. We decided internally that we would make an interpretation on that, and our interpretation is that covers birth through adulthood. So basically, if you choose to use a singular proprietary device, then you can choose all the sizes of that device. Now, some agencies have chosen to use a device for pediatrics and another proprietary device for adults. So if that's the case, then you just need to carry the pediatric sizes, carry the adult sizes, and make sure that there are no gaps in the age groups. Now, yes, the regulation states pediatric and adult, but I would think that everybody would want to make sure that we are able to take care of all the patients that we are tasked with taking care of. So, and I would think that would be from birth through adulthood. So I think that we just want to make sure that everybody is able to be able to take care of all the patients that they encounter, and we never know. You guys know as well as I do, probably even more so now, that we never know what we're going to encounter. So having birth through adulthood is just a good idea and a good practice. Something that I have not sent out, and I just got yesterday afternoon late, is we've been informed that there, as many of you know, if you've tried to purchase a vehicle over the past while, and especially a truck, there's a microchip shortage. And that has trickled into the ambulance industry as well. Basically, there's been a halt on new manufacture of ambulances unless it's already in manufacture, or if they're able to find a chassis that has already been manufactured. But if they're having to go out and buy a new chassis at this point, it's a no-go, because we've been informed, and really and honestly, they don't know when this is going to be remedied. So we're just kind of in a wait and see pattern now. I wanted all of you all to be made aware that this has lengthened an already lengthy process of trying to buy a new ambulance. So hopefully this just, for now it just affects new ambulances, but I think the remounts or remanufactured ambulances are okay for now, but we'll see where it goes from there. I do want to update you guys on the personnel accountability report that I try to update you on each call. We're in kind of a holding pattern right now. I think over the past 6 to 7 weeks, we've been at about anywhere in the 7 to 11 range each week. So this week we've got 4 EMTs, 1 AEMT, and 2 medics off. So I think that's, to me, honestly, I think that's good. I think we're at a steady state, which is a good place to be at this point, just because that's kind of. And if we've gone back and looked at the historic numbers, and we have our curve has kind of mimicked what the state has done. So, and we've been similar throughout the pandemic. So it's a good holding pattern. I do want to address one more thing as far as the 2020-21 block grant. Now this is for funds that were supposed to be dispersed last August. We've told many of you that we had gone back and reviewed, and that we had awarded some agencies that didn't get the award originally. So we sent out those funds for the agencies that got awarded in January, and then we inadvertently sent out some of the funds again last week. We've reached out to all of the agencies. If you have heard from us, if you've gotten an email, hopefully that's been self-explanatory. If not, you can reach out to me, and I'll put my email in the chat here in just a second. But if you have any questions about that process, it's for the agencies that got the money in at the end of January, beginning of February. Again, this is not for the upcoming grant cycle. Those funds will still be dispersed in August, September of this year. This is for the 21 grant cycle. Just trying to be really clear about that, because we've had some discrepancies in what people read and what was on the paper. So again, guys, thank you. You are so appreciated. We have a lot of internal conversations, and we're just grateful for you guys, everything that you do, the sacrifices that you make, especially over the past year. Please just know that it does not go unnoticed. I know a lot of times you don't feel a lot of it from the general public, but you are inside of this office and inside of my home. So thank you. And I am going to hand it off to Greg Hiles, our marketing director.
Thanks, Paul. First of all, as everyone else has said, I just want to wish you a happy EMS week, and today a happy EMSC day. And I sincerely want to thank you personally, because I could honestly probably wouldn't last one day doing what you all do, probably even 1 hour. So I'm just feel very fortunate to be in a position where I have a job that I can recognize all of you all for the great and wonderful things you do. And also thank you for everyone who's participated in our big EMS week campaign. It's been really, really special and rewarding, and I think has just got us all really pumped up around here to see all the stuff that you guys have been sharing, posting, interacting, and engaging with. And I have to give a shout out to our people here as well at K-Beams, who have provided content that I can share forward out. That's really, I think things are starting to shift where we're seeing a lot more of the personal faces of EMS. And I think that's a really, really cool thing. And I just want to encourage you all, like I said before, in my mind, what I'm thinking is, I always refer to it as the KY EMS Forward campaign. It will go beyond just EMS week. So I just want to ask you all to keep sharing these things. If you want to call a special attention to anything, feel free to tag us on your channels. Or I know you all stay extra busy, so you're more than welcome anytime to email me at Greg, Greg, .Hiles, HILES, at kctcs.edu. And we're glad to support you and recognize you and uplift you any way that we can. What I always say and what we're wanting you all to see is that we're not just a regulatory agency. Even though that's what we are, we're still here to support you and uplift you and recognize you in any way we can. So please let us know what we can help to do that at any time. As Mike was saying earlier too, meeting with the Camp Hero person yesterday was really, really cool, just to see the possibility of that partnership. And we've also been able to align ourselves with a lot of other great partners lately that are going to present, I think, a lot of cool new opportunities to share with you all, which kind of leads me into my next thing. We were really excited to be asked to help support the Kentucky Office of Rural Health's Kentucky Rural Provider of the Year award recognition this year. And I just wanted to give that group a huge shout out, because they're such great partners to us. And I wanted to give Scott Helle with KORH a minute to talk about the award recipient this year.
Thanks, Greg. I just want to say to everybody a happy EMS week from us, from me and the Kentucky Office of Rural Health. Like Greg said, we created the Rural Kentucky EMS Provider of the Year to go in with the EMS week and with support of K-Beams. This year, yesterday we announced the winner of the first year was Ralph Miller of Ohio County. So we just want to give him a big round of applause for helping take care of EMS and the people of his county. So again, thank you guys for everything that y'all do in EMS.
Thanks, Scott. And next, I will turn it over to our Director of EMS Data Systems, Drew Chandler.
Thank you, Greg. Yesterday, the agency administrators received an email via KEMSYS from Alethea Bernard, who is our somewhat new statewide CARES program administrator. That message included links to an informational flyer, detailed PowerPoint slide presentation, which are also on the website. We created a section on the K-Beams website under the K-Stars heading, which is in the gold banner, for these CARES resources. We also created a category within the support portal for agencies to submit questions to Alethea. On the K-Star section of the website, I also want to call your attention to a link to the NEMSIS version 3.5 transition timeline. The June 2021 is the anticipated date for K-Stars to begin accepting this latest version of NEMSIS, which is a requirement in regulation. And July 2022 as a deadline for agencies to complete their transition. You should be prompting your PCR solution provider for more information about their plans and to schedule your agency for its transition. A failure to transition at the agency level will create an incompatibility with K-Stars and possibly cause a lack of compliance with the data regulation, which is something that can be avoided and we don't want to see. So as we get closer, a checklist will be released so that the expectations of our office, the individual agencies, and the third-party EPCR solution providers are clearly defined. Along with the topic of agency data submissions, we've noticed a recent uptick in the number of late data submissions. Our measure for compliance with the data regulation has always been whether or not data was received or report of no incidents by the deadline. So each agency administrator has a K-Stars account because of the synchronization from KEMSIS. When you log into K-Stars, this would allow you to monitor the records submitted by your EPCR solution provider. And that is a recommended best practice that you do it at least on a monthly basis to make sure that what we have in K-Stars reflects what you're collecting in whatever brand of software that you're using at your agency. If it's been a while since you accessed your K-Stars account, they do deactivate after 45 days. You may need to submit a support ticket to ask for that to be unlocked. I do want to draw your attention to Mr. O'Neill's report later in the call as the data regulation is included. The most significant changes aim to improve timeliness and completeness of reporting, as well as quality by requiring responding crew to document instead of using a third party to do data entry. Thank you for your attention. Happy EMS week. And I'll hand the presenter role to Robert Andrew, our Director of Education, Certification, and Licensing.
Thank you, Drew, and happy EMS week to everyone. And thank you for your service and everything that you do for your communities. The first thing I have is we have a new financial header on the KBMS forms page. There's 3 new documents there. These are all related to payments of the applications that are submitted. One is for payment for services and TEIs, and you'll use this form if you're paying for agency or TEI applications by check. We do not accept partial payments, so make sure that your check payments include all of the applications exactly as the invoice states. The second one is for registering check payments for individuals, and this form's used if you're paying for individual applications by check. Again, we don't accept partial payment. The third one is a journal entry for KCTCS agencies, and that involves our direct journal entry process for those that are on the call. We have new CE courses online through Train. Of course, I've mentioned these in the past. These are the pediatric abusive head trauma courses and the first responder Narcan administration training through the Kentucky Department of Public Health, and those that are participating in the FR Care grant. We have 2 others under development right now for release, and that's sexual violence awareness training and determination of death. We expect to have those available June. Our EMS continuing education available on our website, kyems.com, and the gold banner, and then you go to education, continuing education, and halfway down the page, you'll find online courses. We have the Prodigy EMS and CCP refresher on there. They discontinued that at the end of March, but they have brought this back, and it will continue through December 31st. So those of you that still need your continuing education, I highly recommend the free Prodigy EMS refresher. It's a 30-hour refresher, and it will cover National Registry hours as well. Jones and Bartlett Public Safety Group, of course, you all know we've partnered with them to offer credible, reliable, and affordable continuing education to you all, and that was mainly initiated during the COVID-19 emergency, but they've agreed to continue this beyond that and continue the price, the $1 a credit hour as well. We've recently added the courses that they created for Kentucky, the NREMT 2016 NCCP Continuing Education Package. And these cover the national component for all levels. That would just leave your state and local hours for you to complete. And in addition to that, there's some research subscription available at a discounted rate, which is for mainly services who want to provide continuing education to their personnel in bulk purchases. On our website, you'll find that information and your state contact through JBL Public Safety Group. We're also planning a sexual violence awareness train the trainer course. It's being offered online June the 23rd or the 24th through the Kentucky Association of Sexual Assault Programs. Again, we'll be enforcing the sexual violence awareness training requirement in 2022. The KBEMS emergency regulations are still in effect, and you'll find those on our website under the COVID banner. And if you click read more, it'll take you to the information that you need to find out about how to obtain certain licensing and other information in the regulations. And that's all I have. And I'm going to hand it off to Monica now. Thanks.
Thank you, Bob, and good morning, everyone, and happy EMS week. Yesterday, Deputy Director of Administration Chuck O'Neill and myself were invited to give a lecture as a part of the CATS lecture series. We discussed 2020 stroke incidents in comparison to the previous calendar year of 2019 to determine if there were any disparities between stroke patient demographics, geographic areas of importance, peak incident times, average response times, air transports, and medications administered during COVID-19 year 2020. If you're interested in viewing our presentation, I have uploaded the presentation slides to our website. You can find the presentation on the KBEMS website by clicking on K-Stars in the gold banner. And in the left-hand navigation pane, click on Publications. I will also post the link here in just a moment in the comments section. In addition, a stroke incident report will be released tomorrow to both the KBEMS social media sites and webpage. So please be on the lookout for that. Lastly, we're working on several different data reports. So as always, be on the lookout for those to be released. And feel free to contact me at any time if you have any data questions. And that's all I have for you all today. So with that, I'm going to pass the mic to EMSC Project Director Morgan Scaggs.
Thanks, Monica. In addition to EMS Week, the Wednesday of EMS Week is always EMS for Children Day. So obviously that's a day of this week that's special to my heart, and we felt there is no better time to release our list of awardees for the 2021 Voluntary EMS Pediatric Recognition Awards. And so I've put together a short video, and I'd like to share that with you now. So I just want to say thank you to all of the agencies who have participated this year and in previous years. We are recognizing 24 agencies again this year. And they have all made a commitment to meeting the additional criteria of our pediatric recognition program. Within the chat, if you scroll back a couple of postings, I included a link to this video. We'll also, if anyone would like a downloadable MP4 version of it, I'd be happy to share that as well. And then I'm also linking to our press release announcement, and I've included a list of the agencies that you saw named in the video. This is open every year to all of our services. You do have to meet the criteria for 1 year prior to applying. So it's the perfect time to start working on your pediatric processes and policies and education and community outreach so that you would be eligible to apply in January of next year. So we offer these out, or we offer to come out to your county council meetings or your board of directors meetings and do a plaque presentation for the agencies that are recognized, and we usually do at least a few of those every year. So if that's something you are interested in, please get in touch with me for more information. Now, I would like to share that, 43.6% of EMS agencies nationally see less than one pediatric patient a month. And so we know that there are some really distinct challenges in maintaining your pediatric readiness. And we would like to share any opportunities that come our way for training or education that might come up. And so there is a webinar later today at 2 p.m. that is about pediatric readiness across the continuum of care. So this one does focus a little bit more on hospital ED readiness. And I'm going to put the links to these in the chat box in just a moment. And then the other webinar to share right away with you is the EMS focused version of sort of pediatric readiness. And that webinar will be tomorrow at 2 p.m. So I've already emailed this out to the pediatric emergency care coordinators and to the agency director or contact that I have listed for those of you who haven't named your pediatric coordinator to date. And I'll share those links as well. The only other thing I had for you today is just to mention that there is a national collaborative called the Pediatric Emergency Care Coordinator Workforce Development Collaborative. We are enrolling in that program for now through August 1st, and the program itself will run from September of this year through June of next year. And so we would really like to see a lot of those pediatric emergency care coordinators participate. There will be about a 3-hour commitment each month, and some continuing education is available for those who participate. And there are a number of customized tracks, including one specifically for EMS. So if that's, again, is something that you might be interested in, we'll be emailing that information out to all of our current pediatric coordinators. And as always, I am available if you have questions, and I will put some of this information in the chat box. That concludes my report for today. Congratulations to the services that we've recognized this year. I look forward to our continued collaboration, and I will hand things over to Chuck O'Neill.
Thank you, Morgan, and thank you for all that you do, and happy EMSC Day during EMS Week, and congratulations to the EMSC award recognition agencies. And we encourage you for all agencies to participate with that EMSC award recognition program. It's very valuable. I've got a few updates regarding legal and regulatory issues. This portion is on our website as well, under legal and administrative regulations. Public comment on 202 KAR 7 201 emergency medical responders, 202 KAR 7 301 EMTs, 202 KAR 7 330 advanced EMTs, 202 KAR 7 401 paramedics, 202 KAR 7 601 training, education, and continuing education, and 202 KAR 7 540 data collection, management, and compliance. The public comment on those regulations will be open on June 1st, 2021 and run through June the 30th, 2021. Please submit public comments beginning on June the 1st, 2021 to my email address, which is chuck.o'neill@kctcs.edu, and I'll put that into the chat here in just a second. A public hearing on these administrative regulations will be held on June 28th, 2021 at 1 p.m. Eastern Standard Time at the Kentucky Board of Emergency Medical Services offices in Lexington. Individuals interested in being heard at this hearing shall notify the agency in writing by 5 work days prior to the hearing of their intent to attend. If no notification of intent to attend the hearing is received by that date, the hearing may be canceled. Also, an update of 202 KAR 7030 fees is being drafted by KBEAM's legal counsel and should be filed in the next 2 months. Community paramedic regulations for both agencies and professionals are currently being drafted. Wilderness paramedic, advanced practice paramedic regulations for professionals are currently being drafted in task force. 202 KAR 7801 medical directors is being revised in the Medical Oversight Committee with the addition of a provision for medical control documents and timelines for processing of EMS protocols submitted. We're also working with constituent groups to draft legislation for the 2022 legislative session on EMS peer review protections. If you are interested in participating in this advocacy, please send me an email and I'll put you in contact with the groups working on this legislation. Dr. Walter Lubbers is the new Kentucky State EMS Medical Advisor and is reviewing protocols at this time. As we were backlogged on protocol approvals, we are unable to provide estimated dates on approval, but we can assure you that we are reviewing protocols as quickly and concisely as possible. We encourage agencies that have not done so or are not adopters of the Kentucky State EMS protocol to adopt KBEAM's destination guidance on patients with symptoms of stroke, STEMI, and for trauma patients. This guidance ensures that agencies triage patients to an appropriate destination facility based upon their illness or injury. Also, please remember that our current plans are to sunset the current emergency orders on December 31st, 2021, unless the sunset is ordered by the governor at an earlier date. For those agencies that have employed drivers under the emergency orders, you should be planning now for replacement of these drivers with certified EMTs prior to December 31st, 2021, as drivers will no longer be eligible to be part of an EMS crew in Kentucky when the ordinary regulations become effective once again. Again, we want to thank you for being proactive and professional EMS leaders. We thank you for participating today and every month with us on these calls. We hope that they're beneficial to you. Stay safe, continue to take good care of your crews and yourself, and have a wonderful EMS week 2021. We will take any questions that you have for the staff in the chat box. I'm going to give this first question to Mike Poynter. If you can address this one, Mike. You talk with Dr. Stack pretty often, but I'm not sure if he's addressed this yet. From Carlos Coyle. Do we know if Dr. Stack plans to put out Kentucky EMS specific guidance based on the new CDC message?
Yeah, thanks, Chuck. And that's a good question, Carlos. I haven't talked with Dr. Stack specifically about that, but I will reach out. And if he does, I will make sure that all service directors get that correspondence.
Thank you, Mr. Poynter. And thank you, Carlos, for the question. From Rick Luperfido. Will there be any new recommendations coming from K-beams related to the wearing of masks after the latest governor's announcement for June? As many of you know, the governor has announced that masks will no longer be mandated by the state in public as of June 11th, and all businesses will be open to full capacity as of June 11th. Rick, we will be following for EMS professionals in the field as far as mask wearing goes. We will be following the CDC guidance and be mimicking that CDC guidance. So we will review that, and Mr. Poynter will talk with Dr. Stack as well as far as specific CDC guidance for EMS professionals, and we will roll that information out to you guys in the field and in administrative roles as soon as we receive it.
Chuck, do you mind if I weigh in there?
Go ahead, Paul.
So Rick and everybody else, I would prepare for the kind of getting used to wearing a mask. I know that it's kind of a pain, but I think in the healthcare setting, it's not going to go anywhere anytime soon anyway. So we will continue to monitor what the CDC says and request guidance from Dr. Stack, but I would honestly think that it's probably something we all need to get used to in the healthcare setting.
And this is Mike. Again, I'll close out here. If there's any more questions, just chime in. But I hope you find these phone calls and conference calls helpful. We're trying to push more real-time information out on a monthly basis. I hope this helps. Also, the last year has really derailed a lot of our normal operations, and I understand on your end too. We're trying to get back into somewhat of a normalcy. It's one of my goals, as I said earlier, to be a resource. I know we are a regulatory agency and we have to enforce the regulations and statutes, but I also want to be a resource to help the individuals, the providers, and the services out. I'm really spending a lot of time on focusing on that this year since we're sort of coming out of the pandemic. And as we move forward, we'll be pushing out more information on that. So are there any more questions? Is that it? Okay, folks, we appreciate your time. It's 11:11 a.m. Eastern time on May 19th from the K-beams office. We're out.